This is the kind of modern health service we all want. Bristol's state-of-the-art radiotherapy machine can treat cancer tumours more quickly and more accurately. Today, the NHS pledged to buy many more machines like this to improve cancer care for patients like Dale.
For me, it's about a 3 to 4 hour round trip to have literally 5 to 10 minutes radiotherapy a day for over a 6-week period. So the more that, obviously, the more of these machines that can be located around the country, particularly in rural areas where it's harder to get to the major cities, I think that's fantastic news.
The NHS in England is going to focus on delivering faster cancer treatment, plus better access to GPs, shorter A&E waits, and improved mental health services, including more talking therapy and extra beds for young people with mental illness. But there is going to have to be a trade-off. In return for improvements to some key services, more people waiting for routine operations like hip replacements and cataract surgery are going to have to wait longer. NHS England's boss believes the public will accept this.
But why am I less deserving as a non-urgent patient than someone wheeled into A&E?
We absolutely want to make sure that we continue with the very short waits we've got, some of the shortest waits in the world actually, for those kind of non-urgent operations. But we know that the public's top priority is making sure that if you're really sick in an emergency, the NHS is there for you and your family. The public will see better access to their GPs, faster A&E care, big improvements in cancer and mental health.
My mother was a lovely woman.
But sometimes a non-urgent operation can be a matter of life and death. Stephen's mother died after her heart surgery was postponed.
She'd gone to the very, very edge, and she had after that 10-week period, she had no more time left, and yet they were complacent enough to put it off for an extra couple of weeks, and it was too late.
Critics say the new plan should have stated the case for more cash for the NHS.
Overall, it ignores the single crushing problem in today's NHS, and that is lack of adequate funding. We've seen the government's answer to this only a couple of weeks ago when the budget came out. They've decided not to fund the NHS to the level it needs, but to tell it to make further efficiency savings.
Today, the NHS has set out what it can do with the money it's got. It's for patients to decide if what's on offer matches their expectations of what the health service should deliver.